Hi guys, so my name is Yoel Antonio Rojas and I am from Puerto Rico and I'm a plastic surgeon working in New York and Los Angeles. I remember when I was a kid, I used to go to the ophthalmologist and the ENT doctor with my mom, and I used to be fascinated by all the machines in the office, and I was telling myself I want to be able to do that when I grew up. So I went into med school, and quickly in med school, I've always been artistic, so in med school I wanted to do something that involved using my hands. So I decided to do surgery. I started with general surgery, and while in general surgery, I fell in love with burns and burn reconstruction and trying to make people look better after being disfigured in such a traumatic event like a burn. And then through burns, I decided to expand my reach in making people look better and reach their goals with their appearance by doing a formal plastic surgery residency. I started my education in Puerto Rico, back home in Puerto Rico, where I did school and then went into college and then medical school. Right after med school, I went into general surgery residency. I did 5 years of residency, became board certified in general surgery, and decided to continue training instead of going into private practice, and moved to New York to do a burn fellowship, also critical care, and then a plastic surgery fellowship. So during my general surgery training, I got exposed to trauma surgery. And I always say to everybody, this was the rotation that really challenged me and let me grow up and become a true surgeon by facing the challenges of trauma. And I remember being in charge of the trauma unit when I was in more towards my senior year. And I can tell that really made me grow, not only as a surgeon, clearly, but also as a compassionate human being, taking care of the actual trauma victim, but also the family that was waiting outside. And then through trauma, I also got exposed to burns, which basically set the path to go into burn reconstruction, which set the stage to go into plastic surgery. Now, I do plastic surgery with the goals of making people look and feel their best and focusing on body contouring. I always told myself, I want to treat the whole body. I don't want to limit myself to just a specific area. And by finding a niche in body contouring plastic surgery, I feel like I'm making art, a very impactful art that affects the entire body of the human. So my favorite procedure. So I like anything body related. I would say when we do mummy makeovers, when we do liposuction both in female and male patients, those are my favorite. Those are my #1 procedures, and I feel very lucky and blessed that I have been able to build a name and a reputation and a niche really in this type of plastic surgery. I always love to see the patient in the before state and transpose in my mind, create a three-dimensional vision of what can I do for that body to transform it. With females, yes, the mummy makeover. With males, we can also do gladiator transformations with the implementation of liposuction and fat grafting. And in females, the fat grafting, we can enhance the breast, we can enhance the buttocks, we can enhance the curves, and give plastic surgery a more artistic approach. I always say, the limit in plastic surgery is your imagination, and I learned that from my mentors back in training. And I truly believe the limit in plastic surgery is your imagination. If you take that imagination with honor, with responsibility, you set the stage for success. Oh, if you're hesitant about having plastic surgery, come on over, let's have a chat. My philosophy is to really listen to you, listen to your concerns, and put your mind at ease. This is responsible, board certified plastic surgery. We take things seriously. We make sure that you're fit for this procedure before we even consider putting you on the table. We really become a team. My philosophy is for you and I, you as my patient, me as your doctor, your provider, becoming a team and creating a plan together. I think when we do that, we then set the stage for good expectations and then excellent outcomes. So if you have, unfortunately, you feel like you had a botched plastic surgery in the past and you're looking for some sort of improvement or fixing the problem, Again, number one, go to a board certified plastic surgeon with experience in dealing with complicated cases. Here in our practice, both Dr. Emer and me, we do a lot of revision cases, and that's what you should look for. Somebody who has the experience and who can provide you with photos of results of these complicated cases. If you feel like you have a botched job, you might be depressed, you might be sad, might be down. There's light at the end of the tunnel. Let us help you find that light. We can help you. Come on over and let's see what we can do to make you better. Working with Dr. Emer has been an adventure. First of all, it started with just me joining what I call an empire of good dermatology and body contouring, dermatology and plastic surgery. A very, very interesting but dead impactful combination, powerful combination. It was a big honor to have this opportunity to become bi-coastal, working in New York, where I started and built my early years of my career, and now expanding into the West Coast in Los Angeles. I love learning about dermatology with him. I think we make each other stronger, because now my patients not only get good plastic surgery or good body contouring plastic surgery, but I can also enhance the results and take them to the next level by also caring about skincare, scar care. Is a perfect combination for the ultimate result. I think my philosophy for patient care, it starts with just being honest, being myself, and really, I think the patients can sense when you really care. And when you listen, you sit on that chair, and my patients know this. You're not rushing. You want to listen to them, understand them. I'm also a hugger, so if a hug is needed, you're gonna get a hug from me. I think that's the key for patient care. Building trust and making your patient feel like they're in good hands and they're with somebody who really cares, that it's not like rushing or running to go to the next one in the room next door. I think that's key for patient care. So my life outside of the job or work, I would say I go to the gym. I could be considered a gym freak or a gym rat. I go to the gym 5 to 6 days a week. I'm very religious with that, and I strongly believe that if we're gonna transmit a message of healthy lifestyle, we have to start ourselves by setting the example. So to me, it's sacred. My time at the gym is the time not only to work on my physical appearance and my health and my strength, but also a time for myself, a time that I take to think. I might be doing a machine or lifting some weights, and I'm doing a lot of mental work, planning what I'm gonna do the next day, or the cases that I have in the operating room the following day, or for the rest of the week. So I incorporate that into my life. It's outside of work, but I incorporate it in a fun way. Besides going to the gym and exercising that way, I love going to the movies, and I love doing Lego. I'm gonna say it, playing with Legos, but not just playing with them. I like to build complex structures and complex buildings. I have my own hospital with operating room, you guessed it right, operating room, heliport, recovery room, maternity room. I even have a cafeteria in the lobby of the hospital. But the thing is that I like to have a vision, I can see what I wanna build, and I use my hands to build it. In a way, I think it relates to what I do with my patients, because I'm pretty good at creating a three-dimensional vision in my mind of what I want to accomplish, and I transpose that and make that a reality over the surgical table. So this is a brief introduction of who I am. I would love to be your provider. If you feel like you're ready, you're at a stage in your life in which you want to make a change, and you think body contouring plastic surgery it's needed, or maybe your solution or your next step, we're here for you. You can come on over, do a consultation. Let's see what we can do for you, and together we become a team and get you closer to your goals.